Hi, Karen here. I thought it was time for my 6 week checkup. It's been 6.5 weeks now. I had my 6 week checkup on Monday. Today's now Wednesday. And it wasn't the greatest news. I was expecting to get back to work after next week, and it looks like it's going to be pushed out a little bit. I'm not able to put any of my shoes on. Well, I went and bought a pair of athletic shoes that were extra wide so I could put them on because the surgeon said he wanted me to start wearing athletic shoes and put away my surgical shoe. So the news is my incision had not fully closed, and it should have by this time. And so it's still here a couple days later, still not closed. So my foot is also fairly swollen still. That's why I can't put the shoe on. And I do have some pain on my sesamoid bones, which are the bones just underneath the joint that the big toe comes off of. The one that had the bunion in the first place. And the surgeon said that pain is due to not having moved those bones in that way for such a long time, with the deformity. So what he did for the wound is gave me some, I don't remember the name of it. It's a silver antibacterial cream that I'm supposed to put on it and keep a Band-Aid on it. And then I also wrap the foot with, he gave me some more of that stretchy kind of gauze to wrap the foot and keep the swelling down. And I'm still wearing the toe socks to help my toes from swelling up. I don't find that I can tolerate walking or standing for very long before I start feeling the pressure of the swelling still. I know my age has something to do with it, as much as I wouldn't really want to believe that to be true. I know I said in one of my earlier videos that the doctor had indicated that for each 10 years of age, you could expect 2 months of post-op swelling. And then postmenopausal women should add 3 months to that at the end. And that puts me quite a ways out there. So I guess the real update is wounds don't always heal at the same rate as expected, and mine really hasn't. It's probably not going to be a problem. It's just slowing things up. And then there's still the swelling. And then third, there is not enough movement in the toe joint. Now, I've been maybe not brutally moving it because I wasn't sure about the pain in those bones, the sesamoid bones, whether that was causing injury or not. So when I felt the pain, I did stop with pushing on the toe. But I don't really have enough of a flex in the toe to walk properly. And so we're going to be doing therapy. I had my my first appointment yesterday. And also I don't have enough movement in my ankle. And when I try to straighten point my toe, I feel pulling at the incision area, at the scar that isn't quite all the way healed. And it's really, really tight. So they're going to work on that. But she does have to wait for the wound to close all the way to do, as much work as she wants to do. Then she's also going to be moving the toe, getting the toe so that it has enough bend in it for proper walking, which would be really helpful for the future if I could walk. And I'm hoping along the road the swelling will reduce enough to where I can put it in a shoe or hopefully a boot, and not have to tear it off within an hour because the pressure is building on the foot. So all in all, I'm coming along. I'm doing well. It might have served me better to have done this 10 years ago when I was considering it. But I think that the surgery itself wasn't available, not the surgery that I got, the Lapiplasty surgery. So the waiting was necessary, and now I just get to put up with the little bit extra longer healing time. I am keeping it elevated whenever I'm sitting and whenever reasonable during the day. Obviously if I'm driving down the road from an appointment, I can't elevate my foot, but when I get home, I will elevate it, and I do still use ice on my ankle to keep, to bring the swelling down. So I've managed to hobble as much as around the block with my dog, but it was quite a struggle, and it was very slow, and I was very sore afterwards. But I just feel like if I don't keep pushing myself, then I'm just going to freeze in place. We don't want that. I don't want that. I know my dog doesn't really want that either. She'd like to go a little further, but I have all that I can do to get around one block. So, hopefully with the therapy and with a little more time, that I'll be able to give her the full walk by summer. And I guess I'm trying to think if there's anything I'm leaving out. It is a little bit tiresome to be home. I'm trying to get out. I went and had my blood drawn today, which was a nice little adventure for my yearly checkup, and I will be doing my yearly checkup pretty soon, just for my insurance purposes. But that's about as much excitement as I'm really getting here. So yeah, carry on with the therapy, and I hope to come back with a lot better news after a couple more weeks. I had to go buy some wider shoes. This is my first day wearing tennis shoes. You can see how much looser the right one is to the left one. It's quite tight on the left, and I don't know how long I can endure it, but I'm gonna try. I started physical therapy today because my doctor's appointment yesterday said that my toe did not have enough movement in it, even though I've been working at it. It's difficult to push it any further.